Hi, I'm Emy Banico. I'm 53 years old. I just had my joint replacement surgery of both of my knees last 22 June. My case was osteoarthritis, and the illness actually started 3 years ago. At first, it was my left leg that was affected, and what prompted me to see Dr. Ochoa was a very strong and severe pain that I had on the right side of my left knee. The pain extended up to the top of my knee, and that made me suffer from walking properly. At that time, when I saw him, he told me to lose weight as much as I could, have daily exercise, and if I couldn't tolerate the pain, take some pain relievers. And following what he had advised me as months went on, I realized that such kind of procedures are not enough. So what happened is that even my right knee had been affected. And just very recently, what made me decide to go into the joint replacement surgery was the intolerable pain that I had. So finally I decided I really should have the joint replacement because the pain can no longer be tolerated. Actually, the idea of operation scared me, so that actually was a very difficult moment for me to make a final decision. And worst was the information that it would take 3 months before I can fully recover. Now with my work, I could not afford to really be away from school for more than a month. So it was really a big decision, a difficult, big decision that I made. After the operation, I just wanted to feel if I can still control my leg. So I started to move my toes. And I remember Dr. Ochoa said, "Oh, okay, that's good. Give me 30 of that." I was happy then to find out that I can move my part of my leg. So I was having an idea then that everything would be normal soon. But my first few hours, of course, in my room at the Asian hospital, I don't know how to move. I felt then that I'm not really mobile. And after a day, the people from the rehabilitation center saw me, and they encouraged me to move some parts of my leg. I was hesitant, of course, because I don't want to feel the pain. But of course, after motivating me to really make some movements, otherwise the muscles would be hardened or rigid or stiff, and the more I would not be able to walk after the operation, scared me more. I tried my best to overcome my fear, and slowly, with the help of the people from the rehabilitation center, and of course the motivation to really get back to normal, I was able to make it. Starting with some movements of my leg from one side to another side, and some sort of trying to lift it even in a small height from the bed. I was able to do that with the help of the therapists. So I think it was 2 days after the surgery, the physical therapist told me, "Mom, we're going to bring you down to the center." Then I asked him, "Why? What for?" He said, "So you can make use of our machines and you can walk there." Me? Walking? I don't think I can do that. The surgery has just been over for a few days ago, and when I reached the center, he gave me a walker. And then he started telling me, "Try to take some steps." And the first step I took forward, I didn't feel any pain. There was absolutely no pain. That kind of feeling made me so joyful, I tell you. I was very, very happy because I felt then that I'm a normal person again. And I was so thankful. In fact, I was teary-eyed that I could start walking normally. Thank God, of course, and thank to the doctors and the therapists. Recovery from the joint replacement surgery, in my case, based on my experience, is actually a product of team effort. the encouragement I got from my doctor, my surgeon, plus the support that my family had given me, the encouragement that my friends who had visited me in the hospital, plus of course the expertise of the people from the rehabilitation center and the technology that was used by the surgeon on me. All of these things, I guess, have contributed so much to a fast rate of my recovery. Now I could really walk. It has just been barely, I guess, less than 3 weeks ago that I had my surgery. I could already walk without a walker, in fact, even without a cane. I guess for people like me who had osteoarthritis, the earlier you had the surgery, I believe, is better, because you would be able to enjoy more for many years the effect of, or the benefit of having the artificial knee, that it's really as if nothing had been changed. So why suffer more like what I had been through for 3 years when you could have it earlier and enjoy the benefit of having such kind of technology? Better have it here in Asian Hospital in the Philippines, because it's cheaper compared to how much it costs in the US, and I guess even in other countries, Asian countries such as Singapore, and maybe even cheaper than India. So why go out of the Philippines? People who have this kind of illness like me should have it here in the Philippines. The surgeons are experts. They have the technology. They have the kind of motivation that it is very encouraging to the patients. The competency is there. So what else we patients should ask for? So I encourage anybody else who have the same kind of illness as I do, that why prolong your agony, your pain, your suffering? Have the joint replacement surgery as soon as possible.